Assalamu alaikum wa rahmatullahi wa barakatuh. Today I'll be explaining the last and final anatomy lecture of the RESP block. So, Bismillah, let's start. First of all, we need to know that this lecture is going to talk about everything to do with the lungs, the anatomy of the lungs, the blood supply, everything to do with the lungs we're going to cover in this lecture, okay? So, first of all, we're going to skip this. We're going to come back to it at the end, inshallah. So, first of all, we're going to talk about the mediastinum. What is the mediastinum? Where is it located? Why do we need to know what the mediastinum is aslan? The mediastinum is this area in orange, okay, in the orange circle. So this is the mediastinum, and here you can see it, this is the mediastinum, okay? So the mediastinum is basically the center part of the thoracic cavity, okay? It's located specifically between the two lungs, these are the two lungs here. The part in the middle is known as the mediastinum, okay? So we need to know the boundaries of the mediastinum. The mediastinum superiorly, the superior boundary is the thoracic inlet, inferiorly the diaphragm, anteriorly the sternum, and posteriorly the 12 thoracic vertebrae. Now we only have one more boundary left, which is the lateral boundary. The lateral the sides. Okay, so laterally the boundaries are this green one we can see, which is known as the parietal pleura of the right and left lung. Parietal pleura is the ghisha or the membrane that covers the lungs, okay? So it's the one in green here. This is they form the lateral boundaries of the mediastinum, okay? Now let's talk about the lungs. So the lungs, we all know we have two lungs, right and left lung, right? So we have the apex of the lungs, which is this part on the top. It's the pointy part of the lung. Okay, so this is the apex of the lung. And then we have the base of the lung. So the apex is towards the neck and the base is towards the diaphragm, okay? So for this, I'm gonna discuss it down, so you can skip it now, okay? Then we're gonna talk about the surfaces of the lung. So we have three surfaces for the lung. We have the medial surface, the lateral surface, and then the inferior surface. We can't see it here, we can see it here. The inferior surface, okay? So inferior surface is easy, it's towards the diaphragm. So the inferior surface is towards the diaphragm. بعدين we have the medial and lateral. Laterally, it's gonna be هنا عندنا ribs. So the lateral surface is gonna be related to the ribs. بعدين the medial surface is gonna be divided into two parts. We just mentioned the mediastinum here in the top above, right? So the first part is going to be related to the mediastinum. So we're going to call it the mediastinal part, which is part of the medial surface of the lung. The second part is going to be related to the vertebra. So we're going to call it the vertebral part of the medial surface, okay? So the medial surface is divided into two parts, the mediastinal part and the vertebral part. The lateral is related to the ribs and the inferior is related to the diaphragm, okay? Now, these three slides here are a summary for all these slides, okay? So you don't have to go through these slides. I'm going to skip them, okay? After I'm done with explaining, I'm going to skip them and we're going to start. You can skip all these and start from here, okay? If you want, So I'm going to explain all these slides from these three slides here. So first of all, we need to focus and know how to differentiate between the right and left lung, because this is the most important part of this lecture also, and to differentiate between which structures are on the right and which structures are on the left. And the doctor is probably going to play on that part in the exam. She's probably going to ask which structure is found blah blah on the right, and then she's going to put the answer that could be on the left as well. So you have to focus and remember, concentrate which structures are on the right and which are on the left. Tamam? So the right, we have three lobes, okay? Superior lobe, middle lobe, and inferior lobe. Then we have fissures. Fissures are the parts or the things that section these lobes. They divide these lobes or they separate these lobes. So we have two fissures. The first fissure is known as the oblique fissure. It comes from the posterior part of the lung all the way to the inferior. So this is the oblique fissure. But then we have the small fissure known as the transverse fissure or horizontal fissure. Tamam? Now let's move to the left. So for the left, we have only two lobes, okay? We have superior and inferior. هنا في right we had superior, middle, inferior. هنا we have superior and inferior only. Then we have one fissure only because we have two lobes only, so we're going to have one fissure. The fissure is known as the oblique fissure. نفس اللي هنا. Oblique fissure, okay? Then we have three borders, an anterior border, posterior border, and inferior border, okay? So let's start with the ones that are the same. The posterior and inferior are the same on the right and the left. شكلهم or they look the same exactly on both sides. The anterior is the one that's different. So we're going to start with the ones which are the same. The posterior and inferior, the posterior is rounded. So here we can see the posterior it's not very clear on this section, but here we can see it. This is the posterior. It's like round, okay? So we can see this is the posterior, تمام? It's here, it's in blue, and I wrote posterior in blue. So you can, everything here is almost color coded. So if you see any color and the same word يعني with the color, it's probably like related to it, okay? So this is the posterior border, تمام, of both lungs, and they're both ايش rounded, okay? Inferior border, we can see it here كمان. It's ايش, it's sharp, okay? It's on both, it's the same thing on both lungs, okay? So we said هنا the posterior and inferior are the same on both sides. Now let's go to the anterior, which is the different one. The anterior on the right side, okay, is vertical and sharp. It's this one in purple. It just goes straight, vertical and sharp, okay? On the left, it's different. How is it different? It continues straight, and then there's something known as the cardiac notch. The cardiac notch. This is on the left side wide, and we have the heart on the left side. So we need space here for the heart, تمام? So this area known as the cardiac notch is the area for the heart. تمام? That's why on the left side the anterior border is different than on the right. تمام? So we said it's going to be straight or vertical, and then there's a cardiac notch. This notch لما it goes in كده to form like a cave or like a notch, and then it comes back out, right? This area, we call it إيش? Lingula. Lingula. Okay, this area is known as lingula, okay? So on the left lung, on the anterior border, we have a cardiac notch and a lingula, okay? So this differentiates the anterior border of the left lung من the right lung, okay? Now let's move to the hilum. What is the hilum? The hilum is the middle part of the lung, خلاص, here, where everything, all the structures that are piercing the lung go through, okay? So this is known as the hilum. It's the area in the middle اللي فيها كل the blood supply, the nerves, the arteries, كل شيء, they're found in the hilum, okay? So we need to differentiate between the right and left, as I said. The structures on the right and the structures on the left. First of all, we need to know where's the site of the hilum. The hilum is in the middle, or it's the vertebral level for it is the middle four thoracic vertebrae, which are ايش? T5, 6, 7 and 8. T5, 6, 7 and 8. يعني T5 to T8. هذولي the four middle thoracic vertebrae, okay? So الهايلم الثوراسيك vertebra حقتها is T5, 6, 7 and 8, okay? The structures, we have main structures and other structures on the side. So we're going to focus on the main. The main structures are ايش? VAB. V-A-B. VAB. Remember van in the previous lectures? Now, forget about van. We're going to go to VAB, okay? V-A-B. V is for ايش? Pulmonary vein. A is for the pulmonary artery, and B is for the bronchus, okay? So the pulmonary vein and pulmonary artery are both عادي on both sides, on the right and on the left. The bronchus is the one different. يعني هنا we said the posterior border and inferior border are the same, بس the anterior فيها difference. هنا نفس الفكرة. We have the vein and artery are the same on both sides, بس the bronchus has a difference, okay? So let's see the difference. First of all, let's start with the right, okay? So the right, as we said, it's VAB, V-A-B, okay? So this is the pulmonary vein. If we remember in the foundation, the pulmonary vein and pulmonary artery are one of the arteries and veins that have an exception in the whole body, right? So what's the exception? إنه the pulmonary vein carries oxygenated blood عكس the other veins اللي في الجسم. والpulmonary artery carries deoxygenated blood. That's why it's blue here, and that the artery is blue. In general, the arteries are usually red لأن they carry oxygenated. However, for the pulmonary artery, it has an exception, and pulmonary vein as well, it also has an exception. So the pulmonary vein carries oxygenated blood, and pulmonary artery carries deoxygenated blood, okay? فهنا we have the superior pulmonary vein, and then the inferior pulmonary vein, and then we have the pulmonary artery, and for the bronchus, we have the bronchus divided into two parts. The first part is إيش? Eparterial bronchus. Eparterial bronchus. And then we have إيش? hip arterial bronchus. Okay, so عندنا ep يعني فوق. Okay, so above. So eparterial bronchus and hip arterial bronchus. Okay. بعدين we're gonna go to the left side. The left side we're gonna see the main structures as well, which are إيش? VAB we said. So V A B. So we have here the pulmonary vein, superior pulmonary vein, superior pulmonary vein, inferior pulmonary vein, and then pulmonary artery. And then here we have one bronchus, but it's called the left main bronchus. Okay, so the left main bronchus is just واحد. On the left side we have one bronchus. On the right side we have two parts for the bronchus: epiatrial bronchus and hipatrial bronchus. Okay. Now let's move to the other structures. The other structures are bronchial vessels. Bronchial vessels هم اللي they supply lungs نفسها. يعني these vessels, the arteries and veins, they're just here for gas exchange. They don't supply the lungs. أما the bronchial vessels they're the main supply or the main blood supply for the lungs. We're going to talk about them more in the end of the lecture, okay? Then we have the lymph nodes, okay? And we have the pulmonary ligament. What is the pulmonary ligament? This is the pulmonary ligament. The pulmonary ligament is, remember the pleura for the lung that covers the lung? So we have parietal pleura and visceral pleura. So imagine this with me. If you have a paper, okay? So if you have a paper and this is the paper كده, you're gonna fold the paper, okay? And then fold it back out. يعني two papers كأنه you get your two hands كده, you put them together as if you're gonna clap, and then you flip your hand. When you flip your hand, صح في النص, there's in the middle, there's this small fold or this small area, right? So this area is known as the pulmonary ligament. It's the area that it's formed when the pleura of the lung is flipped. يعني when the visceral and the parietal pleura are formed, they're the same pleura, يعني it's not two different surfaces. It's the same surface, but it's just flipped. So the area or the meeting point of these two when they flip forms the pulmonary ligament, okay? It's just one of the other structures in the hilum, يعني it's not very, very important, yeah. Okay. These are questions here. So for example, here we have the most anterior structure to the hilum or in the hilum of the right lung. So we know this is the anterior surface and this is the posterior surface or this is the inferior surface. So if we're talking about the hilum, if she asks the anterior structure of the right lung or the anterior structure in the hilum of the right lung is going to be it's going to be the superior pulmonary vein. Okay, if she asks on the left lung, it's also going to be the superior pulmonary vein. What about the inferior, the most inferior structure on the right and on the left is going to be the inferior pulmonary vein. So inferior تمام. هنا برضو inferior pulmonary vein. But then we have here comes the difference. The most posterior structure on the right is going to be the hipatrial bronchus here. Most posterior hipatrial bronchus. But on the left, it's going to be, the most posterior is going to be the left bronchus. لأنه we said we only have one bronchus on the left, not two. So on the left side, the most posterior structure on the hilum of the left lung is going to be the left main bronchus, okay? But then we have the most superior. Here, the most superior is going to be the epiatrial bronchus. أما on the left, we don't have epiatrial bronchus. So the most superior on the left is going to be the pulmonary artery. Okay, so the most superior structure in the hilum of the left lung is going to be the pulmonary artery. أما the most superior structure of the hilum on the right lung is going to be the epiatrial bronchus. And then which structure is found in the middle of the hilum of the right lung is going to be the pulmonary artery because it's found in the middle. And which structure is found on the posterior wall of the bronchi is going to be the bronchial vessels. Okay? Now let's move to the impressions. What do impressions mean? Impressions mean زي الحفرة أو المكان for the structure or for the vessel to go through. So if we pay attention here, we can see there are a lot of impressions here. All of them, I've lined them in colors, okay? So as I said, mostly everything here is color coded. So we're gonna start with the right lung as usual, okay? So first of all, we need to remember something. The right lung always has veins, but the left lung always has arteries, okay? So mostly right عنده veins, right veins, left arteries, okay? نتذكر إنه right veins, left arteries. Okay, so starting with the right lung, as we said, I think the best way we can study these impressions are by the questions the doctor mentioned, okay? So let's go over the questions and then we're gonna know all the impressions. First question we said here is the structure anterior to the right hilum. So we're gonna use the hilum as our reference or as our point where we say anterior, posterior, superior to the hilum, okay? So the structure that is anterior يعني على قدام from the right hilum is going to be the cardiac impression, also known as the impression for the right atrium. So right atrium اللي هو حق one of the chambers of the heart. This is the impression اللي يدخل فيها right atrium. Okay, so here we have anterior to the right hilum we have the cardiac impression or the right atrium impression. Okay, then we have structure close to the lower border of the right hilum. The lower border of the right hilum is this part. So this is the hilum, the lower border حقه. Which impression can we find here? We can find the inferior vena cava. The impression for the inferior vena cava. أما superior vena cava, where can we find it? We can find it above the cardiac impression. And this is the cardiac impression or the right atrium impression. Above it, we can find the superior vena cava. And inferior or below right hilum, we can find the inferior vena cava. Okay? Then we can see the structure that's close to the apex of the right lung. The apex is this part, right? The structure close to the apex of the right lung is going to be the right bronchial vein. Okay, so the right bronchial vein is close to the apex of the right lung. Okay, then we have structure superior or above the right hilum. Superior or above the right hilum, right here. This is the right hilum. Right above it, we have arch of azygos. Azygos here قلنا vein, صح? So right side always has veins. So the right hilum, the structure right above it is the arch of the azygos. تمام? And the structure posterior to the right hilum is going to be the azygos vein. So هنا posterior or behind the right hilum is going to be the azygos vein. تمام؟ فهنا الارch حق الازygos is superior or above the right hilum. تمام؟ أما posterior to the right hilum is going to be the azygos vein. But then we have the structure above the arch of the azygos. What's above the arch of the azygos? اللي هم الtrachea والesophagus. الtrachea is more anterior لأنه قلنا this is the anterior border. The trachea is more anterior while the esophagus is more posterior. تمام؟ كده we're done with the right. The right has more impressions than the left. We're going to see the left. The left is a bit simple. Look, we have to remember قلنا الhilum is going to be our point of recognition or the point where we decide on which is above and which is below and all that. Okay, so the left hilum has an arch above it. هناك في right we had an arch above the right hilum which was known as the arch of azygos. Above the left hilum we have an arch which is the arch of the aorta. ليه؟ لأنه قلنا left has the arteries and the aorta is the main artery. أما the right has the veins. Okay, that's why we had the azygos here. So above the left hilum we have the arch of the aorta. Posterior to the left hilum we have the descending aorta. Above the arch of the aorta, okay, what do we have? We have the esophagus. So the esophagus is found on both on the right and on the left. And مع الesophagus we have the left subclavian artery and the left common carotid artery. So the left subclavian artery is more posterior while the left common carotid is more anterior. And this is the anterior border. Here we can see the cardiac notch and the lingula and all that. Okay, so كده we're done with the structures of the left lung. Here we can see this is the esophagus, but it's a continuation of the esophagus. So what are the questions the doctor said here? Structure superior or above the left hilum, we said arch of the aorta. Structure posterior or behind the left hilum, we said the descending aorta. Structure above the arch of the aorta اللي هم the esophagus left subclavian left common carotid. Structures found in both, or the structure that's found in both the right and the left is the esophagus. But then the structure found only on the right هي الtrachea. The trachea is only found on the right. You can also say this مثلا vena cava is not found here مثلا. No, we're talking about the common structure. يعني احنا قلنا كل الveins are on the right, كل arteries are on the left. So other than the arteries and veins, a structure that's only found on the right is the trachea لأنه it shifts slightly towards the right. عشان كده we can't find it on the left. طيب كده we're done with all these slides. Okay, what we're going to talk about now are the bronchopulmonary segments. So what are the bronchopulmonary segments? The bronchopulmonary segments are the functional units of the lungs and they're the site of gas exchange, okay, or where gas exchange occurs. تمام? Now let's see the right segments and the left segments. So the right lung is divided into segments and the left lung is divided into segments. هنا عندنا segmental bronchus, segmental pulmonary arches and segmental pulmonary veins. Okay, these questions we're gonna come back to them after we're done with the segments. So for the right segments we have 10. That's what we need to remember. They're 10 ثابتين ما يتغيروا. For the left they're different. Sometimes they're 8, sometimes they're 9, and sometimes they're 10. So all we need to know is the right are 10 and the left change. They're either 8, 9 or 10. تمام? Why do they change? We're gonna see now. So for the right, we know the right lung has 3 lobes. So we're gonna have an upper lobe, a middle lobe, and a lower lobe. تمام? For the upper lobe, it's gonna be divided into 3 segments. The first segment is gonna be the apical segment, لأنه it's close to the apex. So apical segment. But then we have the anterior segment and the posterior segment. تمام? Then for the middle lobe, we have the lateral and the medial. So the medial and lateral segments. And then for the lower lobe, the last lobe, we have the apical as well, لأنه it's close to the apex كمان. So the apical, the anterior basal, the posterior basal, the medial, where is it here? The medial basal, this one, and then the lateral basal, which is the orange one. Okay? So these are for the right lung. They're 10 segments, they're set, they don't change. Okay? Now let's move to the left lung. So for the left lung, عندنا 2 lobes only. So we have the upper lobe and the lower lobe. تمام? So for the upper lobe, we have أول segment is known as the apical or apico-posterior segment. It's either 2 segments, they're either apical segment and posterior segment, or they're apico-posterior segment. They're merged together. We consider them one segment. That's why the left segments are different. Like they're not a set number. They change. لأنه sometimes ممكن يكون apical لحاله, ممكن posterior لحاله, ممكن they're together. Okay? Then we have the anterior superior and then we have the anterior superior lingula, which is this one I think, and then the inferior lingula. Then we have the anterior superior lingula and the inferior lingula. This is for the upper lobe. Now for the lower lobe, we have the apical as well, and then we have the anterior basal, which is this one, the yellow one, and then we have the lateral basal, which is the orange one, and then we have the medial and posterior basal. So this is the posterior basal, and then the medial basal is not always present as well. Sometimes it's there, sometimes it's not. Okay, so that's why sometimes for the upper lobe here we have 4 or 5 according to the apical and the posterior, if the apical and posterior are merged together or if each one is separate. And for the lower lobe, we either have 4 or 5 according to the presence of the medial basal or the absence of it. Okay? So now we know the segments for the right and the left. What's the importance of these segments, or why are these segments important? For example, if a patient has pneumonia and it led to fibrosis, okay? We don't have to remove the whole lung. We can only remove one part or one segment. That's why we need to know these segments. That's why we need to know which segment is on which part. But we need to know the upper lobe has apical, anterior, posterior. Middle lobe has medial and lateral. Lower lobe, but this is all on the right lung. We need to know which one is on the right and which one is on the left. But then the lower lobe has apical, anterior basal, posterior basal, medial and lateral, and so on. Same thing for the left. So these are the questions the doctor mentioned. Remove the superior lobe of the right lung. If we remove the superior lobe of the right lung, what are we going to remove? We're going to remove the apical, anterior and posterior segments. If we remove the middle lobe, which segment are we going to remove? The middle lobe, which is this lobe here. We're going to remove the medial and lateral. If we remove the lingula, which segment are we going to remove? اللي هي هنا اللingula. We're going to remove the superior and inferior lingulas. Okay? And here's the same question the doctor said. If a patient has pneumonia on the apical segment and is fibrosed, what do we do? Segmentectomy. Segmentectomy. We don't remove the whole lung or the whole lobe. We just remove the segment. تمام? Now let's see the difference between the right and left. We can come back to this at the end because we're going to talk about the nerve supply and all, and then we can come and use it as a final revision, okay? So now let's see the surface anatomy of the lung and the pleura, okay? So the surface anatomy, what's the importance of the surface anatomy? The surface anatomy is extremely important for like clinical purposes and for examinations, okay? So we need to know where exactly each part of the lung lies according to the ribs. تمام? So let's forget about this table for now لأنه it seems complicated and we're gonna simplify everything and explain it here on this diagram. تمام. So first of all, we need to know, and we're gonna know the surface anatomy from two surfaces. We want to know the anterior surface and the inferior surface. Okay, so هنعرف الانterior والinferior surfaces. So first of all, we know that this is the posterior surface, then we have the vertebrae, and this is the anterior surfaces. We have the sternum and the clavicle. Okay, so we're gonna forget about any odd number. All the numbers we're gonna have are gonna be even numbers, يعني 2, 4, 6, 8, 10, 12. Okay, any other number we're gonna forget about it for now. First of all, we're going to start with the lung. We want to see for the lung and for the pleura, right? So we're going to keep the pleura for aside right now, and we're going to focus on the lung. So the lung, the most superior part of the lung is the apex, right? So the apex is found 1 inch above the middle 1/3 of the clavicle. يعني نروح عند clavicle middle 1/3, we go above it 1 inch, we're going to find the apex of the lung. تمام? Now we're done with the apex. Now let's go to the anterior border. For the anterior border, as we said, we're going to forget about the odd numbers. We're going to only remember the even numbers. So هننسى number 1. We're going to start from number 2. We're going to start from the second rib. So we're going to start from the right side and the left side. We're going to start walking and going down, right? On the right side, we go from the second rib all the way to the sixth rib on a vertical and straight يعني line. خلاص يعني from the second to the sixth rib كلها كده قطعة واحدة. Okay? أما from the left side, we go from the second all the way to the fourth, and then we stop. We don't go to the sixth, we go to the second to the fourth in a straight and vertical line. But then why do we stop? لأنه here we have the cardiac notch. So from the fourth to the sixth is the deviation for the cardiac notch. So from the fourth rib to the sixth rib is the deviation for the cardiac notch. تمام? So قلنا on the right side, the anterior border goes from the second rib all the way to the sixth rib in a vertical and straight line. However, on the left side, it goes from the second all the way to the fourth in a straight and vertical line. Then it deviates from the fourth rib all the way to the sixth rib to form the cardiac notch. تمام? So, if we ask about the anterior border of the right lung, it's gonna be second to sixth rib. If we ask about the anterior border of the left lung, it's going to be vertically second to fourth rib, and then it deviates from the fourth to the sixth rib. تمام? Now كده we're done with the anterior. Now let's go to the inferior. So inferiorly, where is the lung, or where does it sit, or which ribs does it articulate with? تمام? We're going to see now. الانفيرير هنقسمها lung و pleura. We're going to keep the pleura aside as we said for now, right? So we're going to focus on the lung. The inferior border is formed by 6, 8, and 10. تمام؟ اللي هم the ribs. تمام? So how can we see them? We're going to see إنه هنا. First one is 6 we said. So it's going to be mid-clavicular. Mid-clavicular. يعني هنا الكلافيكل. في نص الكلافيكل هننزل تحت هنا. It's going to be on the 6th rib بس in the mid-clavicular line. Okay? So this is the first inferior surface, or the first inferior articulation of the lungs. Okay, this is the same for right and left. تمام؟ يعني for the right and left, the inferior surface كلها نفس الشيء. So it's going to be 6 for the mid-clavicular surface. Mid-clavicular surface. Then we have 8. وين حنشوف 8? 8 we're going to go to the posterior side. 8 is going to be mid-axillary. So هنا maybe it looks like it's on 9, but it's actually on 8. يعني في آخر 8 هنا. It's going to be on the mid-axillary. Mid-axillary اللي هو يجي هنا, this line here. This is the mid-axillary. So it's going to be the mid-axillary line against the 8th rib. تمام? And the last one is going to be the 10th rib. It's going to be paravertebral. يعني opposite or behind the vertebra. So paravertebral. Paravertebral is on the 10th. So كده عرفنا الانterior والinferior borders of the lungs. Here it's the same thing on the table here. The apex نفس الكلام اللي قلته. الانterior it's still the fourth, but then it deviates في left and it continues to the sixth في right. نفس الشيء, okay? The green part is the pleura, we didn't mention it yet, okay? So but then here we said إنه for the backward or laterally it's 6, 8 and 10. So قلنا 6 is mid-clavicular, 8 is mid-axillary, and 10th is opposite or paravertebral. تمام? Now let's move to the pleura. So logically, if we have something that's covering something or an organ that's gonna expand, so the lung expands, we all know that the lung expands when we inhale air, right? So we need space for the lung to expand. For the cover or the membrane that's covering the lung shouldn't be exactly the same size of the lung. It should be a bit wider, or should have space for the lung to expand, right? That's why the pleura is going to be a little bit different when it comes to the inferior border. So for the anterior border, it's the same as the lungs. It goes all the way from the second rib all the way to the sixth, تمام? But the only difference is إنه it goes closer or more towards the sternum. فتروح كأنها داخلة في نص الsternum كده. يعني it's not on the side or the margin of the sternum. لا, it goes in the middle or a little bit close to the middle of the sternum, so it can give space here. Here, the space we can see here. I don't know if it's very clear, but the space between the lung and the pleura. As we said, we need space for the lung to expand. So it tries to go more internally or more close to the sternum, so it gives space for the lung to expand, okay? That's the only difference for the anterior. For the inferior, we need even more space لأنه the lung is going to expand, right? So all this is the space that the pleura gives to the lung. So how does it give the space? By the inferior border. The inferior border, هنا قلنا the lung, the inferior border is 6, 8, and 10, right? For the pleura, it's going to be 8, 10, and 12. تمام؟ بس they're both the same. يعني مثلا 6 and 8 are both the mid-clavicular in the mid-clavicular region. يعني هنا the mid-clavicular region, mid-clavicle, we have for the lungs we have the 6th, and for the pleura we have the 8th. But they're in the same place in the mid-clavicular region. تمام؟ Same thing for the mid-axillary. هنا قلنا this is the mid-axillary for the lungs. It's going to be the 8th. أما for the pleura it's going to be the 10th. So they're both in the mid-axillary, بس this is for the lungs and this is for the pleura. So the red one is for the lungs and the blue one is for the pleura. And the last one here is the paravertebral, or opposite to the vertebra. We said for the lungs it's going to be the 10th, and for the pleura it's going to be the 12th. Okay? So you have to differentiate between the inferior for the lung and the inferior for the pleura. Why is the pleura wider, or why is the pleura in the ribs below? لأنه we need more space for the lung to expand. تمام? These are the questions the doctor asked here. Lower border of the lung at the mid-axillary level, it's going to be إيش؟ في lung, it's going to be the 8th, which is here. And what about the pleura? It's going to be the 10th. Okay, so here the mid-axillary blah 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 for the pleura, it's going to be إيش؟ 10th. Same thing for إيش؟ The mid-clavicular, for the paravertebral, and so on. Okay. Now كده we're done with the surface anatomy of the lungs. This is everything I just said. Now let's move to the last part of the structure, which is the blood supply of the lungs. So for the blood supply, we have two circulations. We have pulmonary circulation and bronchial circulation. The pulmonary circulation has oxygenated and deoxygenated blood because it's a circulation for gas exchange. It's not for supply for the lungs, okay? أما the bronchial circulation, this is the circulation that has the supply for the lungs. So it has oxygenated blood, okay? Let's start with the pulmonary circulation. The pulmonary circulation, we said it's for gas exchange, and then pulmonary arteries and pulmonary veins. And as we mentioned above, pulmonary arteries and veins are exceptions. So the pulmonary arteries have or carry deoxygenated blood, and the pulmonary veins carry oxygenated blood, okay? The pulmonary artery originates from the pulmonary trunk, and it goes from the heart to the lungs. And the pulmonary vein goes from the lungs to the heart, okay? This is stuff we already know from the foundation, and it terminates in the left atrium. Tamam? Now let's move to the bronchial circulation, which has the supply for the lungs. Tamam? So a bronchial circulation has bronchial arteries and bronchial veins. The bronchial arteries have, because they're normal arteries, they have oxygenated blood خلاص to the lungs, and the bronchial vein have deoxygenated blood from the lungs. Tamam? For the arteries, we have right bronchial artery and left bronchial artery, because we have right and left lungs, so we have to have right and left for everything. So for the right bronchial arteries, we have one artery which originates from the third posterior intercostal artery. So if you can see here, these are the intercostal spaces. This is the first, second, third. So this is the third intercostal space في posteriorly, okay? This is posteriorly. So here we're viewing the ribs من ورا, posteriorly. So this is the third intercostal space. The third posterior intercostal artery is right here. It gives a branch that supplies or that gives the right bronchial artery. تمام. أما the left bronchial artery, there are two. So the left has two. Where do they come from? They come from the descending aorta. تمام. So نتذكر إنه the left has the aorta. The aorta is the biggest or the main artery that supplies the whole body. So it gives out a lot of branches or many branches. That's why the left has more arteries or more blood supply than the right. Okay? يعني نتذكر إنه the right has one right bronchial artery. أما the left, because it has the aorta, it has two bronchial arteries. Okay? They come from the aorta. So the aorta gives two branches, one branch here and the other one here, which gives us the left bronchial artery. أما the veins, we have the left bronchial vein and the right bronchial vein. For the left and right, if you remember in the previous lectures, for the right bronchial vein, it's gonna go, anything on the right goes when, or is drained where? Through the azygos. So a right bronchial vein is gonna be in the azygos vein. تمام. أما left bronchial vein ends up where? In the superior hemiazygous vein. تمام. Last but not least, the nerve supply. For the nerve supply, we have sympathetic fibers and parasympathetic fibers. The sympathetic are the ones we use when we're fighting or when adrenaline is high. And the parasympathetic is the one used when we're sleeping or كده. Or we're relaxed يعني. So the parasympathetic vagus nerve, okay? The actions حقتها bronchoconstriction. This is part of the physiology lectures. Bronchoconstriction, vasodilation and all that. And for the sympathetic fibers, it's going to be the sympathetic trunk. They come from the sympathetic trunk. And the action is bronchodilation and vasoconstriction. So, by that we're done with the lecture. Let's go back to the table we said we're going to use for revision. So, قلنا هنا, this is differentiation between the right and left lung. The right, as we know, it goes straight. So, ما عندنا cardiac notch. The left has a cardiac notch because it has the space for the heart. And then we have a lingula here. Also, for the right, we have 3 lobes and 2 fissures. For the left, we have 2 lobes and 1 fissure. Here we have 10 segments. Here we have 8, 9, or 10. And we saw why. But then here we have 1 bronchial artery. And here for the left, we said we have 2 because we have the aorta. The aorta gives us more branches. And then for the right, it's just shorter and larger, while the left is longer and smaller. Okay? One more thing here is, why is the base for the right lung more concave? يعني why is it like this, more concave, while the left is like this مثلا? It's a little bit less concave because we have the liver here, which pushes against, or we need space for the liver. So that's why we have the base for the right lung is more concave than the one for the left. For the left has the cardiac notch for the heart, and the right is more concave عشان the liver. تمام؟